Dallas City Manager T.C. Broadnax, thank you so much for your time today. Really appreciate it. You've done a number of budgets in your career, but I have to imagine this has to be the most challenging one yet. Tell me about it. Is that true?
You know, I have done quite a few budgets, and this one had different dynamics. There's always been financial challenges that cities encounter every year, but to combine your normal annual issues with revenue with a pandemic, it has definitely been a challenging time and brought out the creativity, I believe, from my team, as well as I think the comments and suggestions from the City Council.
And there were projections of a $100 million shortfall. Is that still the case? And does your newly proposed budget include any layoffs or furloughs?
So, as you may know, and the public should know, we are required to adopt a balanced budget. So the $100 million projection, which was a high end early in the summer, we have resolved that particular anticipated deficit. So our budget is balanced. There will be, as you asked, some furloughs continuing, primarily based on the issues around COVID and our ability to open our facilities, as well as individuals' comfort in attending any of the services that we provide, whether it's Parks and Rec or our libraries. But we have balanced the budget, and I might add, with no increase in the city's tax rate.
And I'll get to that in a second, but I wanted to ask you, as far as the furloughs, how many are you expecting? Because I think through the end of September, there are about 415 employees on furlough. What's it going to look like after September 30th for the new budget year on October 1st?
So we have begun to bring several of those employees back. We're still, I think, in the range of a little over 200 to 300 employees, again, that are on furlough status, pending our ability to be able to move back into a different scale of activity at some of our departments.
You mentioned that you proposed a budget that has the same tax rate as last year, 77.6 cents per $100 of valuation. If that is approved, wouldn't that still mean that residents are going to be paying more in property taxes next year because of rising property values?
It would. Right now, based on the average value that we use when we use a static home, that number that someone might be able to project, I think the number is about $325,000 is our average home, would see an increase just with our rate the same of about $135 a year over what they paid last year, just based on that growth and us maintaining the current rate.
Is that fair during a pandemic?
Well, I wouldn't necessarily say it's fair or unfair. What I would say is the cost of service has risen and the demand for service has not gone down as it relates to what people expect the city to do. I think it's been tough and challenging for us. I know we have tightened our belt here at City Hall, as well as tried to streamline and provide services in a different opportunity and space as it relates to where we are with the disease. So I think for the services and to maintain the level of services, we are not degrading any particular service that the city provides. I think it is what's needed to keep the organization whole and to provide the services that people expect.
In your budget proposal, you said that the city is relying on almost $57.5 million in new property taxes revenues from this current year, $34.8 million from newly added properties, which a lot of cities around the country can't say, and about $22.7 million in increases from existing properties. But that's not set in stone just yet. So how much of a concern is that you could be dealing with, very fluctuating numbers until the counties certify those property values?
You are correct. I think our financial staff has done a great job, particularly looking at historical erosion as it relates to properties under protest. And I think we've struck a decent balance and a comfortable balance, probably more on the conservative side as it relates to what we've estimated, particularly in conversations with our taxing authorities. And so I don't feel alarmed or concerned. I think we'll adjust, obviously, when those get finalized. It would be my hope that there are not too many adjustments we'd have to make based on our estimating versus what is actually certified once that's complete. But I don't feel uncomfortable at all, given the talent of our financial staff and the conversations they've had.
Mayor Johnson has called for a defunding of the bureaucracy. He has called for salary cuts. He's called for eliminating some positions. Did you do any of that in this budget? Are there salary cuts for the top people, such as yourself?
So thank you for that question. No, those were not things that I recommended in the budget. There were, however, reductions and eliminations of positions, in many cases, executive level positions, to find ways to, again, save money in addition to the other changes we made operationally and or any restructurings that we may have done to find ways to find resources to put into services that I think the community has asked for and that we are trying to fund in this year's budget. So again, we took a different approach. The conversation with council began on this past Tuesday. I'm looking forward to the continued conversation so we can share with them exactly where we were able to reduce our funding to provide the services. Again, many of the new services, we actually put in on estimate about $13 million of new operating services to benefit our residents, in addition to about $18 million in infrastructure related improvements in our community. So again, all said and done, I think this budget provides the types of resources, the dedicated commitment to many of the issues that have bothered this community for decades. And I'm pretty proud of what my team was able to do and looking forward to working with council to adopt this budget.
And I just wanted to ask you one thing you said there as far as the streamlining of the bureaucracy, for lack of a better term. Does that mean that if things were streamlined or you reorganized, if you will, does that mean that there was still an actual reduction in those budgets?
Yes, sir. When you look at our budget overall, it is $1.4 billion in the general fund. That's where we spend the bulk of our conversation. That number, year over year, is down $30,000 from the prior year. There were reductions we've made, very strategic in some cases, to reduce certain departments. So there are some increases in departments, particularly around efforts that are new and or wishing to expand as it relates to in concert with what council and our community has asked for. And then there's areas where there were reductions. We have flattened certain parts of our organization. I have actually reduced executive positions in the city manager's office in response to some of the requests. And so again, I believe the budget on a whole, particularly since it does not call for mass and organization-wide furloughs, is responsive as it relates to continuing to provide services, as well as looking to see how efficient we can be to provide those services.
What impact did the federal aid have with regards to the coronavirus relief from Congress that the city received? How much of a help was that for this current year that we're still in? And were you able to use any of that for next year's budget?
So it was a tremendous help, Jack. We received $234 million in CARES Act funds in March of this year. That allowed us to, one, firm up the types of things we needed to go out and protect the community, as well as protect our employees. It allowed for us to provide resources to small businesses and residents, particularly around business loans, as well as in some cases, direct assistance around rental provisions. It also allowed us to purchase PPE and then support alternative and additional steps and measures that many of our personnel had to take to respond to having COVID out in the community and allow them to continue to do their work. So it definitely helped in the current fiscal year as it relates to the ability to being able to charge many of our employees' salaries to that as they were working as frontline individuals. It also is supporting police and fire and some other entities providing services that are allowed for to be charged towards the Corona or CARES Act funds in the current and upcoming fiscal year that begins in October. We're actually defraying some of those costs that otherwise would have had to be general fund by charging the appropriate line items towards that. So it definitely was a big help. We obviously may need more help, and so we're encouraging additional resources from the federal government, particularly if the disease continues to linger in our community. There may be a need for additional PPE and other types of assistance to provide for our residents.
I wanted to ask you just about the impact from last October's tornado. I can't believe we're already coming up on a year. And so, I mean, the city still took a hit on that, a financial hit, because FEMA would not grant the 75% reimbursement for public infrastructure losses. Isn't that right?
Definitely. We are still in pursuit of a change in the recommendation by FEMA on allowing for us to receive the assistance that we so rightfully deserve. We're continuing to reach out to individuals in Washington, as well as our delegation here to reach out to folks in Washington. And so we're still looking to find ways to make sure that we can bridge that gap. But at this point, we're working with our insurance agencies to help as it relates to where we had coverage, finding a way to make sure we can rebuild those facilities, and working with the state and other partners on particularly around the infrastructure that was damaged around street lighting and intersection poles to find ways to fund and offset and find our own match. So we're going to plug those holes as we resolve and finalize the bidding on some of those issues, but it's definitely still being pursued and something we need to help us, again, get through that disaster that occurred in October.
Wanted to talk to you a little bit about public safety, which obviously is always one of the main concerns here in the city of Dallas by residents, and one of the biggest drivers of the budget. I don't have to tell you that. You have issued or proposed a number of policing reforms. You had the mayor's task force on safer communities. You've proposed a mobile response team, expanding the Right Care pilot program. Talk to me a little bit about that and how key those are to reducing crime and to make the police department more efficient.
So those initiatives that you just shared are key. I think they've been a focal point, particularly the mayor's task force recommendations around finding ways, one, to engage youth in a different manner. We have funded and supported and recommending a violence interruption program to have credible individuals in our community work with some of our youth to try to help them understand de-escalation tactics and really be able to resolve issues in an appropriate manner. Right Care, we had a pilot program that was being undertaken in one of our patrol divisions. We're looking to expand and add 4 additional teams to support that effort in response to the 13,000 mental health calls we get annually, to reduce the opportunity for conflict and allow that to happen in an environment with trained individuals, trained specifically around mental behavioral issues, to be able to respond. And we're hopeful in the following year in our planned budget to add 5 more teams for a total of 10. And our mobile response, I think, again, is another alternative and another opportunity to get police out of areas where they may not be the most skilled and find ways to connect with our residents on a different manner and at a different level to provide those wraparound services. So there's quite a bit in this budget that what we would say reimagines how we approach the interactions with law enforcement and residents, and we're hopeful to continue to grow those areas and allow our law enforcement personnel to do the job that they were hired to do and allow people to do jobs that, again, they were trained to do around some of those issues that don't involve law enforcement.
I've read your comments that you are not defunding the police department, but I did notice that you have proposed reducing the number of sworn officers from 3,150 at the end of this year to 3,095 in 2021 and 3,040 in 2022. Why is that, and does that go against the council's wishes from last year?
So thank you for the opportunity to address that very directly. So those numbers, as you see them, displayed, reflect where we are currently in the environment of COVID. The class sizes that we are allowed and or are recommended by the medical personnel that work with our police department has indicated that the class size should not exceed 25 in each cadet class. And so we're going to do 6 classes in the upcoming year. So that will allow us to hire 150 officers at that level of the class size. Unfortunately, every year we look at and we experience attrition where officers who are eligible to retire and leave. And so in that case, we've estimated right now that about 200 officers, give or take, may leave, which is consistent with past historical trends. And so therefore, that's why you see a net reduction in officers. And that is the driving reason behind that. I will say I've shared and will continue to share with council based on the medical advice of our individuals that work with the police department. If those classes are able to be expanded, we will do that. No different than this year. In the current year, we hired 97 more officers than we had budgeted this year because we were so successful. And so again, if we can increase the class size, we will, unless told differently. Right now, I have not gotten any indication that that is the case. And so we will, again, follow the medical science on how we staff our police cadet classes, and we'll grow that should we get the guidance from them that it's allowable to grow it. The last thing we want is officers training to be officers getting sick before they've even had the ability to go out and work in our community.
So this, if I hear you correctly, Mr. Broadnax, this is basically a limitation by COVID, not a limitation by the budget.
Correct.
Okay, so if you're able to do it like this year, you'll do it. You'll add officers. You'll add.
That is our intention, and that's what we've shared with the city council. Definitely.
Okay. And so I wanted to ask you, certainly, murders and aggravated assaults have been in the news lately. They're basically at last year's pace. What is your timetable for reducing this? What have you told Chief Hall about getting those numbers down?
So that is something that, whenever we speak, particularly whether it's with the council or the chief, myself, and one of my assistant city managers talk about crime, we monitor that obviously on a nightly basis, a weekly basis, and then month over month, comparing it to last year. There is no less frustration this year than there was last year. We're hopeful that many of the interventions that we hope to roll out in the latter part of this year and the continued efforts that the police are making to find ways to reduce crime will show up in the numbers. There are a lot of things that are going on in this community around individuals committing these crimes that in some cases it's just because of the relationship and the closeness of individuals and a disagreement that might be had. And so we've got to find ways as a broader community to alleviate many of those stressors that result in people having and or feeling compelled to want to commit crimes. But we're working at it. We're implementing the necessary plans, particularly as it relates to responding to these issues and solving those crimes. But again, I've challenged the chief. We said in the very beginning, we're going to do everything we can every day and every evening to find ways to lower crime. And it's just really a matter of continuing at it and figuring out how, again, we can moderate and or, I guess, excuse me for the word moderate, we can alter and change and respond and address the crime out in our community.
I did have one other question. I really do appreciate your time very much. And that is you talked about the mental health services that these teams that are going out to help the police officers. Is it the city's job or is the county providing any mental health services as well? Is there any overlap?
There is overlap and there is partnership. Oddly enough, just was on a call with the county, sharing the exact same thinking and concern about them partnering with us in a greater way to find ways, again, to fund more of the services that in many cases, counties across the country provide resources. They do spend resources on mental health. And obviously the need outstrips any one entity's resources. And so we've got to figure out how we leverage not just city, county, state, but also the local philanthropic community who understands and sees the need. And there are a lot of people working in this space. We've just got to figure out how we collectively can do more and fill the voids where in fact there exist and people may not even be aware of where services can be received. And so again, I don't think it relies on one particular entity because no one will ever have the resources given the needs, but we've got to do our part as a city and expect that others will do their part and figure out how we can come together to magnify and leverage all of those resources.
Does that mean that the county has not really paid its fair share in providing mental health services?
I can't speak to that. I don't know what that benchmark number is. It's based on what communities and their demographics reveal. And so I won't speak to that. I will know when in fact we sit and we have more conversation about the level of funding. This is a pretty big county with quite a few needs. And they may not have access to all the resources that the city has as it relates to different tools of taxation and others. But again, I'm more focused on how do we partner? How do we respond to people who come and speak to our city council about lacks of services in their community and how we respond as a city and how we can bring others along to assist us when able. But at the end of the day, the buck stops in some cases with us. People expect us to provide services until we tell them that there are services being provided by someone else.